Welcome to the show.
Thank you. Thank you for having us, Daniel.
Oh, it's my pleasure. So, how long have you been practicing?
I've been at it for over 40 years.
Wow.
Yeah, and I started in 1976.
Wow. I mean, that's a combined 70 years of experience. That's incredible.
But we're still learning, believe it or not.
Of course. And I want to talk about that. You have a really interesting study club, an interdisciplinary study club. The reason that I thought it would be nice to have them on the show is because I talk a lot about aesthetics of the body and the face, and my philosophy is that first you have to be a doctor and then you have to be a plastic surgeon. So you have to treat the patient medically first. And it's sort of similar to what their philosophy is. So why don't you tell me about what you're thinking?
Well, what I'm thinking when you're talking about cosmetics is that that's actually the result of what we do, but it starts long before those beautiful veneers that so many people think they want to have and many times do have. But without an interdisciplinary approach where the total health and function of the mouth is considered first, it's not a good idea to just jump in and do cosmetic dentistry without first taking into account the total health of not only the patient's mouth, but of their body as well.
Right, right. That's very important. There's no point in having beautiful looking teeth if they don't work right.
Yeah, and I wanted to make a distinction between cosmetic dentistry and aesthetic dentistry. We really hope that all of our dentistry is aesthetic, but it's not necessarily cosmetic. Cosmetic is designed to take someone with flaws or imperfections and make them more attractive. But sometimes you can have someone who already looks attractive, but they still need work done on the front tooth, for example. We want that work to be aesthetic, but it's not cosmetic in the true sense of the term, because we're not really hiding anything or changing anything. We're just making our work look beautiful, like we always do.
Oh, interesting. Interesting.
It's a true team effort, actually.
Yeah.
What we do, not only the team in our office, but the team that we formed within the community of Santa Fe with some of the specialists in town, and that's what we, what is called interdisciplinary dentistry.
Yeah, talk about that a little bit.
Well, okay. When patients arrive in our office with a multitude of problems, sometimes they come and they say, I don't like the way my front teeth look. We start by taking a full set of records. That may include, beyond x-rays, certainly photographs, three-dimensional models, and quite often an iCAD image to give us 3D imaging of the teeth and the jaw and the entire skull and the airways. And we get together with high-functioning orthodontists and periodontists and oral surgeon, and we plan these cases together before the patient even meets the specialist.
You have a group that meets in the evening?
We do have a group, and usually we meet in the evening, usually about 6 o'clock, and we can go for a couple of hours, and we're planning to travel together to the Scottsdale Dental Center as a group for some advanced training in this interdisciplinary approach.
That's excellent. So when somebody comes to you, they're not just getting you, they're getting a whole team of people. How do people reach you? What's your phone number?
Oh, 988-3500.
You want to say it
and
again?
And as long as we're plugging ourselves, we also have a website, which is the lakinddentalgroup.com.
Okay.
And I wanted to also mention, you know, when people get their front teeth fixed, dentists who are who think of themselves as cosmetic dentists, and maybe if they've taken a few courses and put some veneers on some teeth, are very concerned about what the front of the teeth look like.
Right.
But we are as much concerned of what the back of the front teeth look like. In fact, maybe even more important, that the contours of the back of the front teeth are hugely important and ignored when you just go and get some veneers put on your teeth. I mean, sometimes the backs of the front teeth are fine, but sometimes they're not, and that the slopes and the contours of those teeth determine how the rest of the mouth functions, and it's very, very important in terms of the longevity of the restorations, because it impacts the pathways that the teeth move, the chewing motions, parafunctional movements, because if those aren't smooth and harmonious, then teeth break and get loose.
And form follows function, and that's the basis for the concept that Les Lakind just explained.
Yeah, absolutely. The same is true in plastic surgery, where form follows function, because if you try to overdo something, it doesn't function well. We've talked last week. We talked about Heidi Montag, who has really very large implants, and they may look They may look okay, but people who have implants that big have on average 8 operations in their lifetime to tweak them or fix them or replace them, and it's their choice. But the point is, it's always very important to think about not just how something looks, but how something works. Do you see also non-aesthetic patients, non-cosmetic patients, general dentistry?
Oh, absolutely.
Okay.
Yeah, no,
Children?
We see children. Yeah, our business cards say, and all of our marketing that we do says that we're just dentists. We're dentists, that we do cosmetic dentistry, we do aesthetic dentistry, but we're just dentists. We do a variety of things, or we work with specialists who can help us with a variety of things. No, we definitely want to see the general public and do not at all want to limit ourselves to just the cosmetic dentistry.
In this economy, people often call my office and ask about prices. And we've talked a lot on the show about financing programs and ways for people to afford plastic surgery. Or what can you say to that? What do you have in your office that can speak to that? Yeah.
Yeah. Well, there's a couple of things. We have something called Care Credit, where people can come in and take out a Care Credit loan. It's a company that's really designed, I think, just for the dental industry. So they can get their needs taken care of, and then they pay off Care Credit at whatever the rate they want. Also, we allow people to make payment plans if that's appropriate. And although obviously we have to pay the rent, I didn't go into dentistry with the intention of making a lot of money. It wasn't really what my driver was, and I would never want to turn someone away if they had an emergency or had some basic needs that needed to be met. And we try to figure out a way to meet their needs either more economically or find some way to make them comfortable if they can, so that they can be taken care of.
That's true. Try to reach out to the community, but on a more day-to-day basis, we're often doing larger, more complex types of treatment, especially I do in the office. And those cases sometimes can take anywhere from 3 months to 10 or 12 or 15 months to complete, and the payments can be spread out over that period of time, certainly.
Sure. What kind of anesthesia do you use in your office?
We use local anesthetic. We're not using any IV sedation or general anesthesia.
Okay, so no conscious sedation.
No, although if someone's particularly nervous, we always offer Valium if they want. Very few people take us up on it, but occasionally people do. We also have nitrous oxide, which helps people who are more anxious. I'm a trained hypnotist, actually, so
Well, talk about that.
So, actually, we had a course in dental school. We had a semester course in dental hypnosis, which was really great.
Yeah.
And it's really just another way of putting people at ease, of talking to them in a way that's gentle and calming. So I have that ability, and the other guys, without taking those courses, do the same thing. We also have music on. We have iPods.
Right.
So there's music that's. We have a whole variety of music. Some people like to kind of lose themselves in the music.
Right.
So we have any number of ways that help people relax. And teddy bears.
Okay.
Big teddy
And
bears.
a compassionate staff.
Yeah,
Really.
a fabulous staff.
Fabulous staff.
Great.
We really do.
Good, good. Santa Fe is the mecca for alternative therapies, acupuncture, reflexology, holistic things. Do you incorporate any of those, or do you think about those in your practices when you're doing?
That's a good one for Leslie to answer.
Yeah, I'm pretty knowledgeable about the controversies in dentistry, applied kinesiology, the controversies around root canals and implants. My practice is mostly conventional, but if someone has those concerns, I'm very well equipped to discuss them, and I will often bring them up. If someone has a lot of health problems, I'll often say, this is a controversial field. Do you want more information? And we have some other specialists in the alternative community that we work with, so that people can get taken care of. Because I don't consider myself a physician of the body. So if someone has a lot of health problems, I'll say, look, let's hook up with someone else who can take care of those things. I'll do my part as best as I can as a dentist, and then we'll hook you up with someone else if they need it to take care of those other aspects.
Okay, well listen, we have to wrap this segment up. Thank you very
Okay.
much.
Thanks again for having
Looking
us.
forward to seeing you guys again. You're listening to Talk 1260 KTRC, the Humanity Behind the Vanity. We'll be back in a few minutes. Thanks very much.